And good morning, Dr. John McDougall, Northern California Radio Network. And we're going to learn about the diseases created by modern man today. And the name of the book is Life Guide, Your Guide to Longer and Healthy Life. My guest is a medical doctor, Dr. David Perlmutter. Hello?
Hi there, can you hear me?
Yeah, I got you good.
Good.
Sorry, I'm real good at butchering people's names, but good to have you on the show. What kind of medical doctor are you?
Neurology?
Neurologist.
Correct.
So
That surprised you right off the bat.
yeah, I'm real pleased, and I'm happy to hear the first topic is Alzheimer's and aluminum. Is there any connection?
I think the evidence is pretty clear. There's so much going on in the past year with respect to Alzheimer's research, as you know. But I think that the connection with aluminum has been it's been a speculation for 30 to 40 years now since they've been doing pathologic specimens and looking at the brains of Alzheimer's patients. And I think that connection is clear. I think the epidemiologic studies showing that in places where the drinking water has high aluminum, the incidence of Alzheimer's is greater. So it's something that can be avoided, and it's a simple step.
Well, you know, this surprises me a little bit. I thought I was the only one in the whole medical business that believed that Alzheimer's and aluminum was connected. You know, when I wrote my last book, my publishers told me that was all nonsense, that all had been debunked. And the truth of the matter was that there was no association. And then when I went and did a medical literature review on it, I came to the same conclusion you did, is the evidence is clear, consistent, and overwhelming.
Well, I think that when you do the medical study of a problem like that, and you realize that many of the resources that you turn to write such a chapter or write a book are so mainstream. I mean, you know, we quoted an article called Alzheimer's Disease in Drinking Water and the connection with aluminum, and that was from Lancet. And Lancet, as you know, is one of Britain's most prestigious medical journals. And so there's plenty of good information out there in mainstream, well-respected, peer-reviewed journals. And it's, you know, when you do the medical the literature search and you find these articles, you make the public aware of them, and it begins to have very good credibility.
And it makes all the sense in the world to avoid aluminum since it's not a nutrient, right?
It's not a nutrient. You know, our bodies are very much used to being exposed to aluminum because it's one of the most common elements in the Earth's crust. But many studies have demonstrated that we can handle and process and excrete about 20 milligrams per day maximum. Now, when you figure that many antacid tablets have 200 milligrams per tablet, and people are taking 6 to 8 of these a day, and you know, you wonder what happens to the excess aluminum. Well, it accumulates in the body.
Say nothing of the Pepto-Bismol.
I didn't say it.
Pepto-Bismol. I said Pepto-Bismol. Pepto-Bismol is loaded with aluminum, isn't it?
Sure. There are so many things that are laden with aluminum. It's the reason that I felt that was a very important chapter to include in the book. And I mean, we can go through the list: Malox Plus, Mylanta, Riopan, Rolaids, Tempo.
See, there you get. You named all those people. I can't have as sponsors anymore. Doggone. Life Guide is the name of the book. Your Guide to Longer and Healthier Life. Dr. Perlmutter is my guest. He's an MD. He's a board-certified practicing neurologist. Give us a call, 270. Dr. John McDougall, Northern California Radio Network. With me, Dr. David Perlmutter. Dr. Perlmutter is a MD, neurologist, a rebel.
A rebel in his own mind.
He does not own a cellular phone. Is that correct?
No, I have one in my car.
But you don't have one that you put up to your head?
No, not me.
Why not?
Well, I really will. I think that there's plenty of evidence supporting the fact that that's a dangerous practice. You know, we have to ask ourselves, why is the incidence of cancer of all types skyrocketing? In virtually every type of cancer that you can name, the incidence is increasing by leaps and bounds. It's obviously something that we're doing. Our genes haven't changed. I mean, we're the same people we were 10,000 years ago, but so what we're doing is we're changing the playing field. We're changing the environment, and that's one of the things I think electromagnetic radiation that has significantly changed over the past century, and we need to pay real close attention to it.
Well, couldn't it be things like what we eat? And
sure.
Not cellular phones? I mean, brain cancer has been around a long time, long before cellular phones. I remember spending hours in the operating room operating on brain cancer victims, and I never heard of a cellular phone back then.
Well, true. I mean, there's always been a baseline of these things, and now all of a sudden the incidence of primary brain tumors is skyrocketing. What was really most compelling to me, I had a couple of experiences with patients who did develop brain tumors and were very avid users of their cellular telephones. These tumors were both located in the exact spot where the antenna was in closest contact with the head. And at first I had a tough time making the correlation until I began doing some interaction with a doctor up at the University of Virginia Medical School, Dr. Stephen Cleary, who has actually done research using human brain tumor cells in a laboratory, exposing them to the same type of radiation that is given off by the cellular telephone, and found that these cells then started reproducing like crazy. And that was very compelling to me, so we did a very thorough literature search and looked, in fact, over the entire world literature of the effect of electromagnetic radiation on cancer in general, and then specifically on brain tumors. And what we discovered was very compelling, which is the reason that we wrote that chapter in the book. Things happened very quickly once we became public with our information, as you may know. We ended up on the Faith Daniels program and on 2020, and with my patients, we went to New York, and we're on these programs, and the next day, the stock of Motorola company lost $1 billion, so we certainly had an impact. And at the very least, we got people to at least start thinking about this issue.
Oh, you're a real popular guy. I hope you have a lot of life insurance. Let's go to the telephones, and some of our callers are real anxious to talk to you, Dr. Perlmutter. Jackie, you're on with Dr. Perlmutter. Hello, Jackie?
Oh, yes, hi. Doctor, do you have experience with epilepsy patients?
Oh, yeah. I mean, as a neurologist, that's really, I hate to say my bread and butter, but it's something that we deal with every day.
That's what I thought. I'm actually calling for my sister who doesn't live within range of the program, but I have her on the McDougall program. She has a son who has epilepsy, and his first seizure was on his first day of college. The question she wanted me to ask was, there was apparently, she heard about a study that was done at Johns Hopkins University in the 20s, and it involved a carefully controlled diet that included added vegetable oils, and she wanted to know more about that. Are you familiar with that study?
Yeah, as a matter of fact, that was really the early work done in trying to discover if there are any relationship between diet and the possibility of seizures. Mm-hmm. In a nutshell, seizures happen when the chemicals in the brain in a certain area that control the electricity are deficient. And it's why they develop what's called a ketogenic diet. And it's a very specific diet designed to reduce the amount of ketones, certain types of chemicals in the brain. Since then, however, the information relating seizures to diet has really expanded. And I think one of the most important issues that we're seeing these days is a very strong relationship between exposure to certain food additives like NutraSweet and monosodium glutamate and the possibility of seizures. I think in a person who has his or her first seizure at the age that they're starting college, that requires a very thorough investigation. He should certainly have had a brain scan. It's something that would be important in that age group. And I would think a very important thing would be to put that person on what we call an elimination diet. Okay. In other words, start at zero, put him on some kind of very clean food supplement. There's one called Ultra Clear Sustain, made by the Metagenics company, and then slowly reintroduce foods. Is he having more seizures now, or just had one?
No, he's had a number of seizures, and he's on, I believe it's Dilantin.
All right.
But that gives
Dilantin is a good drug. It's not a great drug. One of the worst things that Dilantin does is it profoundly affects the way vitamin B6 is metabolized in the body. So if he's going to stay on the Dilantin, I would recommend that he be on a very healthy repletion supplement of B6, about 100 milligrams twice a day at the very least. I wouldn't give him much more than that, but I wouldn't give him any more than 300 or 400 milligrams a day. Okay. The other thing to consider is there's a very new drug on the market called gabapentin, or Neurontin. And we've had a lot more success with that in terms of controlling seizures without the side effects of Dilantin. So it might be something to consider.
Okay, Jackie?
Gabapentin and what?
Gabapentin is the same as Neurontin, same name.
Neurontin.
Thank you for calling. We did a show actually about 2 weeks ago on the ketogenic diet and epilepsy with a man named Abrams, whose son got tremendous benefit from that.
It works in some people. You know, there are no cure-alls that fit everybody. I think the important thing is to treat the person who has the disease rather than treat the disease that the person has.
My guest, Dr. David Perlmutter. I'm Dr. John McDougall. Life Guide is the name of the book, How to Avoid Illnesses Created by Modern Man, and we'll be back with you and your questions in just a moment. The author of Life Guide, How to Avoid Illnesses Created by Modern Man, Dr. David Perlmutter, MD, neurologist. He's appeared on shows. Got on the shows, I understand, because of his attack on the cellular phone industry. That's good. That's a good ploy. Take the biggest rock you can find and throw it at the biggest picture window in town. Let's go back to the telephones. Carl, you're on with Dr. Perlmutter.
Yes, Doctor, I was interested in your comments on Alzheimer's and aluminum. I was wondering, since aluminum is in the dust we breathe and in the water and all that, then we can absorb up to 20 milligrams a day, as you say. Why is it important that we give much consideration to aluminum kitchenware? Particularly if you aren't boiling tomatoes or something like that. Is that really a factor, how much absorption a day?
Carl doesn't want to throw out his pots and pans.
Well, I think that we have to just identify what are all the sources of aluminum that we may be exposed to. Aluminum cookware is one, and you certainly can look at tomatoes that are boiled in aluminum pot, and you can assess the amount of aluminum that they pick up, and it's substantial. I think that these are just other things that you have to consider, not using aluminum-based antiperspirants, aluminum-based shampoos, not consuming foods that are enriched or baked goods that have a lot of aluminum in them, baking powders that have aluminum in them. It's not like the aluminum cookware is the cause of the demise of Western civilization, obviously not. But it's just one other thing that it's important to pay attention to.
You know, it gets to some of our presidents.
Yeah.
It wouldn't be too bad if you don't use something acidic in it, I suppose.
Exactly. Acid is the main reason, really, that our vegetables these days are higher in aluminum content than in previous years, and that's probably because of acidification of the rain.
Thank you very much for calling, Carl. And Agnes, you're on with Dr. Perlmutter.
Yes, thank you very much, both of you. Regarding this electromagnetic field, is it dangerous to sleep on the electric heated mattress pad?
How about blankets? How about electric blankets?
Yeah, I think that there's been plenty of research demonstrating that there's an increased incidence of leukemia in people who use electric blankets. Now, this gets to the point that it starts to sound like things that my grandmother used to tell my family. She used to tell my sisters not to go outside using metal hair curlers because they'd get struck by lightning. But in actuality, there have been some very good studies that have been performed that do, in fact, demonstrate that you are at increased risk of certain types of cancer by using an electric blanket. You're also at a significantly increased risk of having birth deformities, birth abnormalities if you're a pregnant woman using an electric blanket. So it just makes sense to avoid it if you possibly can. You know, these problems that we mentioned, once they happen, there's not a lot that you can do about it. Birth defects, there's not a lot you can do to fix them. It's a done deal. Brain cancer is almost universally fatal.
Is that caused by electric blanket too?
Well, it may be. I think that the data that, you know, electricity is a very nebulous term. Electromagnetic radiation. There's all kinds of frequencies and power outputs. The data that supports the connection between possible brain tumors and cellular phone exposure, that frequency, isn't necessarily, you can't necessarily take that same data and say, well, therefore, any exposure to radiation can cause brain cancer. I tend to think that it would, but on this point, I can't really give you hard data to support it.
And thank you for calling. And let's go on to Steve at Sausalito. Steve, you're on with Dr. Perlmutter.
Hi, Dr. Perlmutter.
Hi, Steve.
You sound very smart.
Not me.
I have a rather unique illness that allows me to very rapidly tell what substances are increasing and what substances are suppressing my immunity. And when I eat a ordinary tomato, my immunity is increased, whereas if I eat a flavor saver, cow gene manipulated tomato, my immunity is suppressed as much as drinking a glass of milk or eating foods out of a microwave. Do you want to comment on that at all?
Well, first of all, I think it's very important for people to understand when you say your immunity is increased or decreased. Many of the problems that people are suffering from these days are actually a consequence of an overactive immune system. People say, I want to have more of an immune system, I want it to be stronger. But so many of the problems that people are suffering from these days, like multiple sclerosis and diabetes, Lou Gehrig's disease, even atherosclerosis, are a consequence of too much immune activity. But clearly there is a direct relationship in everybody, not just you. You just happen to be more perceptive, between the foods that they eat and the function and ability to function well of the immune system. And that really works through a group of chemicals which are called prostaglandins, which are made from certain foods that we eat. So you're not alone. You're just like the rest of us, but you're just a little bit more perceptive.
So
Okay.
what do you think about microwave ovens and about genetically engineered food? I think that was probably his question.
Well, microwave ovens, I think, aside from the fact that many of them leak, and although they're not designed to emit radiation, some of them do, I think that the data is somewhat unclear in terms of the chemical changes that take place in food. There have been some reports that changing from D to L isomers of protein, I don't mean to be too technical with your audience, but simply changing the way the molecules look can make them less able to give you important nutrition. The other question about genetically altered food, I think it's a very good question. I think the real danger that I see that's been clearly demonstrated is if we begin to rely specifically on food that's genetically altered, we will ultimately choose just a few varieties of, say, tomatoes or, say, corn to grow. And the way that nature has...
Dr. Perlmutter, let me interrupt. Can you stay with us a little longer? Lots of people want to talk to you.
Okay.
Talk to you. Okay. I'm Dr. John McDougall. With me, Dr. David Perlmutter. He's an MD. He's a neurologist. He has a book out that I'm sure many of you are on the way to the bookstore to get. It's called Life Guide, How to Avoid the Illnesses Created by Modern Man, and we'll be back in just a moment. Hi, Dr. John McDougall, Northern California Radio Network. Dr. David Perlmutter, MD, board-certified practicing neurologist, author of a book that's probably sold out of the bookshelves by now. It's called Life Guide, How to Avoid the Illnesses Created by Modern Man. And I interrupted you when you were telling me whether or not you are excited about genetic fruits and vegetables.
Well, let me just... the bottom line is what we're going to end up doing is depending just on a few strains of fruit, of vegetables of any particular type. And that's dangerous because, you know, what we're fortunate to have right now, at least, are many different varieties of corns and tomatoes, etc., so that when certain things come through, you know, plants get illnesses like people do, and things like the flu and that pass through the population, things like that happen to crops as well. That's why it's good to have a whole lot of different varieties, because it's insurance that you'll at least be able to continue having food stores, food crops. So I think that's one of the big dangers, and I also think that we really run into difficulties when we do genetic engineering, because it's a Pandora's box, and you may manipulate one gene that may have other expressions, as you know, may have other manifestations aside from what you're trying to accomplish.
So don't fool with Mother Nature. Let's go back to the phones. Orlean, you're on with Dr. Perlmutter.
Thank you. I have a comment and a question. There was a lady who called in and spoke about seizures. I have a friend who has 3 children. Actually, he has 13 children, but 3 of them began to have seizures after they had their shots before entering kindergarten. And so he stopped with the next children that were going to start school and would not allow them to have their shots anymore. And I also heard Mr. Lindsay Williams, I don't think he's a doctor, but he spoke on Art Bell's talk show the other night. And he said that in some of the serum for these shots, he's read that there's formaldehyde, there's mercury.
That's correct.
And all sorts of weird stuff. And I wondered if you would recommend that parents don't allow their children to have shots then.
Well, let me just tell you what I did. I have a 4-year-old and a 6-year-old, and my wife and I labored long and hard over this, and we ended up giving our children polio, tetanus, and diphtheria, but we did not give them pertussis vaccine or whooping cough vaccine. I think of any of the data that you look at, the data that links the whooping cough or pertussis, which is the P in the so-called DPT, the P part, the data that links that to brain damage and seizures is probably the most compelling. It's a very rare disease, and you know what? Kids can have whooping cough and get over it. On the other hand, there are thousands of parents who have had severe illnesses in their children, some of them even dying, within 48 hours of having the DPT vaccine, which is the same DPT vaccine that was used 20 to 30 years ago, hasn't been changed as yet, although I understand that there's a new one coming out. So that's what we elected to do, and that's my advice is to simply, you have to make up your own mind after you review the data,
well,
but that's what we decided to do.
Why would they ever put formaldehyde and mercury in this serum anyway?
Well, there's a big debate about mercury. As you know, most of dental science doesn't think that mercury presents any problem whatsoever. Our largest exposure to mercury as a population, according to the New England Journal of Medicine published by the Harvard Medical School, is from the amalgam put in our teeth. And yet 96 to 97% of dentists in this country still put mercury in people's teeth every single day.
Have you had your mercury taken out?
I have. I had all of my mercury amalgams removed several years ago, as a matter of fact. And in fact, I devote a chapter in my book to the dangers of mercury, and mercury amalgam specifically.
Okay. Thank you very much for calling. And Barbara, welcome to the show. You're on with Dr. Perlmutter.
Yes, could you please address cooking with some of the modern pans, pots and pans, frying pans, and so forth, that you have to use very little fat?
Now, what do you and your wife use in your home?
Mostly glass.
How about stainless steel?
Yeah, glass and stainless steel.
You're not worried about the nickel in the stainless steel?
No, not specifically. And really, we eat a very simple diet that really doesn't require much cooking. Our vegetables we simply steam, and we're essentially.
This wouldn't be one of those vegetarian diets, would it?
Yeah, it's completely vegetarian.
Oh, well.
John, let me, if I may, our book is not available in bookstores in California. There's an 800 number.
Okay,
Can I
let's
give it
hear
out?
that. Oh, you bet you can.
And I can get the information there?
Yes,
The
ma'am.
name of the book is Life Guide.
Thank
Okay?
you.
Thank you very much for calling. I'm Dr. John McDougall, and let's see, do we go to Barbara? Hello? Or Bob? Hello, Bob? Bob?
Yeah, Bob?
You're on the show, Bob.
Yes, sir. No, I have two questions here. One, has there ever been a study on Navy and Army and Marine Corps electricians that stand generator watches for 20 years and then retire? Do they have a high thing of cancer? Or the people that work at the Boulder Dam or Shasta Dam or anything else like that, where they're around these generators all the time? Is there a high rate there? And my question number two was on the mercury here.
He's gone.
They're talking about the mercury, it's absorbed into our body here. A little while ago there, the University of California, I believe at Davis, took some swordfish or some bay fish out of the freezers that they captured back in 1940, and the mercury rate was about 30 times what our death rate is today. And this is all from all this mercury that they use when they're stamping out all this gold up here in all these gold mines in California. It just runs right on down the rivers, right into San Francisco Bay.
Bob, I'm going to have to ask Dr. Perlmutter that question when we get him back on the line. We had a little technical problem here. You were just so exciting to get on. It was one of those things where you got on and he got off, unfortunately, so we don't have him on the line right now. But he's a very progressive neurologist, and over the top of his bio says super guest, and I would have to agree. Not many neurologists have this perspective on things or this interest in dealing with things from the point of view of good health, and I have to say the reason is, just like with most doctors, they're too busy treating patients to take the trouble to help them get well. Dr. Perlmutter?
Yes,
we have it on the line. Okay, I'm sorry we lost you there. The question was, how about people who work in the Army and the Navy and around generators their whole life? Do you have any data on that? And the second question, what was that second question, Bob?
The mercury in the water there in the bay in San Francisco, years ago they used mercury for extracting gold up in the gold mines, and it seems like it runs down the rivers right into the bay. At the University of California, Davis took out some old fish that they froze back in 1940, and the mercury content, I think, was about 20 or 30 times past our death rate that we have. It was really, really high in mercury back in the 40s. So the thing, we can get all this mercury out of all this fish that we eat coming down here in California in the bay and the rivers.
Okay, I'll have Dr. Perlmutter answer that on the air, Bob, because we're going to have to go to a break. If you'd like to call in and talk to my guest, and the number is 270. Dr. John McDougall, Northern California Radio Network, Dr. David Perlmutter, MD. The book is called Life Guide, How to Avoid Illnesses Created by Modern Man, and the phone number to call is 1-800-446. Goes into all kinds of issues, and we're only going to be able to scratch the surface of the issues that Dr. Perlmutter has done research and has a very strong opinion on. And the question was, any evidence for reversal of diabetic neuropathies based on dietary change, vitamin supplements, or anything that you do with your patients?
Oh, absolutely. This is the first thing I do for patients with diabetic neuropathy. In Western world, that is probably the most common cause of neuropathy. Worldwide, the most common cause of neuropathy or problems with the nerves is, believe it or not, leprosy. But anyhow, with respect to diabetic neuropathy, I put my patients on massive dosages of vitamin B12. And by that, I mean an injection every day. I teach them how to do it to themselves for a couple of weeks, then every week, and then about twice a month. It's completely safe. The other thing that's very critical for these patients is to put them on good essential fatty acids. I usually use flaxseed oil and borage seed oil, both of which are available at the health food store. The dosage of flaxseed oil is a tablespoon each day, and the borage seed oil probably about 3 or 4 capsules a day, and they do wonderfully.
Well, how about their diet?
Well, of course, that's important. When I have diabetic patients, that's the first thing we do. We work on getting them on a very diet with a very low simplified sugar diet. In other words, all of their carbohydrates are complex.
Mm-hmm.
They're taught to how to recognize and avoid processed carbohydrates, white flour, things like that. I use, obviously, the mainstays like chromium and vitamin B complex, especially vitamin B6. These things are very important. But I think
how about the effect of oils deregulating diabetes and making the diabetes worse?
I haven't noted that. These essential fatty acids they work beneficially in the diabetic in 2 ways. They are prostaglandins, they're the precursors to the good prostaglandins, and as you know, the diabetes is really another autoimmune problem. And in addition, they are probably the most important components in the manufacture of myelin, which is the covering over the nerve itself. So that's the reason that we see that these patients do so wonderfully. Oils get a real bad rap. Fats, which are what oils are it has already a negative connotation in your mind when I say we're going to put you on some special fats. Everybody thinks, my God, I'm not supposed to have fats in my diet. But in reality, without the essential fats, like the omega-3 and omega-6 group, people would die. So they're very important.
And when you take care of the diabetics with a healthy diet, do you see a lot of reversal of the neuropathy?
It's very, very common. We see not only reversal of neuropathy, but reversal of the vasculopathy or blood vessel problems as well. We watch ulcers on the toes heal. We watch people regain sensation, and even reflexes return. And it happens, and we're giving people things that are non-prescription items that they can administer to themselves that don't require frequent visits to the doctor. Typically, most doctors treat diabetic neuropathy by using drugs like Elavil or Tegretol, and these things are dangerous.
And not very effective.
That's right.
How about one disease that, as a person interested in good nutrition, you're probably very excited about treating, and that's multiple sclerosis.
Multiple sclerosis is, again, an autoimmune problem, and what that means is the immune system is misdirected, and in the case of multiple sclerosis, a person's immune system reacts against the covering over the nerves in their brain. And again, that is a disease that is so easy to work with nutrition. As a matter of fact, there's a diet proposed by a gentleman living out in California, which is a very low-fat diet, which has been popularized over the past 40 years, the SWANK diet. But if you take that further and give people essential fatty acids like the omega-3 and omega-6 group, and vitamin B12 is so critically important in multiple sclerosis, these people generally do quite well. Now, I'm not saying on your radio program that here we have a cure for MS, because we don't. But I will submit that the patients that we treat in this way do far better than those who simply go about their day-to-day lives, eat what they want, and maintain an unhealthy lifestyle.
Well, Dr. Swank, who's been on the show many, many times, seems to think that he can get darn close to a cure.
Well, I give him a heck of a lot of credit, and he really came out long before it was popular to talk about nutrition. And
40 years ago.
Yeah, my hat goes off to a man like that, because he's still practicing.
Why is it though, and I'll give you a second to think about it, why is it when you have Dr. Swank's work published in Archives of Neurology, American Journal of Clinical Nutrition, The Lancet, and many, many other journals, that the first thing a neurologist doesn't say to a patient, in fact, you'd probably be one of the few in the United States, the neurologist never mentioned that they ought to change their diet, which is safe, free of side effects, cuts their food bill by 40%, and improves every other aspect of their health, yet it's never mentioned when a MS patient walks into the office. Dr. David Perlmutter, I'll leave you with that question for our break, and when we get back, I'd like to hear an answer. And Dr. John McDougall, Northern California Radio Network, with me, Dr. David Perlmutter, MD, Life Guide, How to Avoid Illnesses Created by Modern Man, 258-page book, and I'll tell you how to get it. You call 1-800-446-60, that's 6065. Dr. Perlmutter, why is it that neurologists across the country don't start the conversation with somebody who has a neurologic disease that's obviously caused by the wrong diet, such as multiple sclerosis? Why don't they start with that discussion?
Well, I think it goes back to medical school. I mean, when we're in medical school, that we are taught that we treat illnesses like an enemy, and we fight the battle using the human body as a battlefield. We treat illnesses with slash and burn techniques. Either we burn things out, cut them out, or we give poisons. And that's the mentality that still is all pervasive in medical schools. Only 25% of the medical schools in this country have any required courses in nutrition at all. And it's basically that way because of the profound influence of the pharmaceutical industry, not only in how medicine is practiced, but even in medical education as well. Unfortunately, I don't see it changing.
No, that's because it takes too much time to talk to people and takes no time at all to write a prescription for a drug.
Right.
And there are a couple lines open. Let's talk to Robert. Hi, Robert.
Hi. I have a question for your guest about cysts. I get a lot of cysts, and they're increasing.
Cysts?
And I'm just wondering what causes them and what...
Are these like
what
skin
can I do
cysts,
to,
Robert?
get rid of them.
Robert, are these skin cysts?
They're just underneath the skin,
Okay.
yeah.
We'll,
They're in the arms and legs.
we'll ask if he has any thoughts on that.
Well, as you know, John, those could be many different types
Sure.
of things. Typically, when people have what are called sebaceous cysts, oddly enough, I find that the problem is most commonly in the gut. And it turns out that when people have imbalanced flora, or the too many bad bugs, not enough good bugs in the gut, that for some reason that their processing of oils is inappropriate, and that may lead to the formation of these cysts. I've treated many patients who have had widespread sebaceous cysts by simply working on reestablishing a healthy gut by using such products as lactobacillus, or even something called fructooligosaccharides, which the health food stores carry. It's abbreviated F as in Frank, O, S as in Sam. And oftentimes this is extremely helpful.
How about putting good food in the gut?
Sure. I mean, that's what we try to do, is undo the damage done by many years from the toxins in the environment, toxins in the food, antibiotics and steroids. These things are all pervasive, and it takes a while to reestablish some harmony in the gut. But so many illnesses, including sebaceous cysts, sinus disease, headaches, ulcerative colitis, so many things are improved when we begin to pay attention to the regulation of the organisms, allowing the gut to actually flourish like a garden.
And let's talk to Jan in Vacaville. Jan, you're on with Dr. Perlmutter.
Hi, I'm interested in his opinion of the chronic fatigue and fibromyalgia syndrome that seems to be everywhere nowadays. I know you recommend diet, and it probably helps in the overall health of the patient, but it doesn't take away the pain. And the neurotransmitters seem to be involved in so many other things they can test for now.
Okay, so what do you think? Fibromyalgia is just is a disease right in your field as a neurologist. What do you do with fibromyalgia problems?
Well, I do a lot with fibromyalgia. It's very interesting. I've been involved very heavily with dealing with women suffering from silicone breast problems, silicone breast implants, and the consequences of that. Now you might wonder, well, why am I bringing that up now since you're talking about fibromyalgia and chronic fatigue? The reason being is that these women, by and large, suffer exactly that. They have diffuse, severe aching muscles and joints, and they are profoundly and overwhelmingly fatigued. We also see this in soldiers coming back from Desert Storm. We see it in people who are exposed to toxins from all sorts of sources. And again, we just happen to be talking about this. My approach to that problem deals with balancing the gut first. Now, it seems very strange that a neurologist who deals with the brain and spinal cord would be spending so much time looking into treating people by paying attention to their gut, but it really starts from there. There is no magic drug for people who are chronically fatigued. And the reason I say it that way is there's a big difference between chronic fatigue syndrome and people who are chronically fatigued. When a person is chronically fatigued and just doesn't have energy, we have to make sure that they have a thyroid gland that is working appropriately, that they're eating appropriately, that they're not on medication that's affecting them. But when you rule out all these things like Lyme disease, etc., and you have an individual who is essentially negative with respect to his or her blood studies and medical workup, and still have an individual who is profoundly fatigued, the first place to look then in terms of treatment is to balancing the gut.
And how do you do that? Is it described in your book and Life Guide?
No, this is not.
Will you put that in Life Guide 2?
That goes in Life Guide 2, yeah, which I'm working on right now.
I know you are.
It's a very major problem. People like Jeffrey Bland are spending so much time in trying to educate the public with respect to what's called dysbiosis, which means an abnormal ratio of bad bugs to good bugs in the colon. The medical manifestations of having that problem are are very vast. I mean, from anything from headaches to sebaceous cysts. That's the first approach I take to dealing with patients who are chronically fatigued and have fibromyalgia. I find that lots of them have candidiasis. Many of them have positive blood tests for candida. That does enter into the treatment. We use various medications to treat candida. It's tough to do it on the radio program in a nutshell.
Yeah.
But
well, Dr. Perlmutter, you've been an excellent guest, and when we get back together again, we'll talk about the issues of dairy products and calcium, issues that you hold similar opinions to as mine. The name of the book is Life Guide, How to Avoid the Illnesses Created by Modern Man. The phone number to call for that book. I want to thank you very much. You're a fine guest.
John, it was my pleasure.
It was my pleasure also. I'm Dr. John McDougall. Look forward to talking to you tomorrow.